It is a privilege to address the Belarusian State Economic University. Today we're going to talk about medical malpractice. The doctors and hospitals, are they really on your side? My name is Kaushik Lode. I'm the CEO of Health USA, a medical device company based out of Los Angeles, California. I'm also the director, the chairman, for the Committee for Disabled Children's Education Rights, Government of Maharashtra, Republic of India.
The greatest trick the devil ever pulled was convincing the world he didn't exist.
Does this problem exist? Let's take a look. When you or a loved one is unwell, in pain and suffering, you feel fear, anxiety. Will this situation be corrected? Will the ailment be healed? Will things go back to the way it was before? Then you see a doctor. You feel a relief. You think whatever you could possibly do, you're doing it. But is that a trick? Are the activities conducted really going to help you? Is the person in the white coat who's standing in front of you really who you think he is? Let us ask some basic questions. Is the doctor that you're seeing really competent? Was your problem diagnosed correctly? Is the doctor focused on what you need? Or does he have hospital management mandated financial targets to fulfill? Certain number of tests, procedures, or even surgeries every month. Did he prescribe the correct treatment? Were the correct dosages prescribed? Are the follow-up and supporting therapies aligned? Do they want to cure your ailment? Or do they just want to manage your treatment? Do they see you as a human being in pain or as an ATM machine? How does healthcare impact the economy is a question Professor David Well of Brown University, Providence, Rhode Island answered very eloquently. The direct effect through better productivity of healthier workers is of course the first impact. Also, an improvement in health increases the incentive for people to acquire more schooling that subsequently increases the level of education. Because they're aging with good health, more people are saving for retirement and thus raising the investment in physical capital. Conversely, a health episode not only affects the individual in terms of medical cost, time lost from work, pain and suffering, hospitalization, etc., but it also affects the people close to him, his friends, his family, who also have to take time off from work to be with that patient. And if an episode occurs, then most likely in the future, medical prescriptions for short term, for long term will be required, follow-up visits will be required, and there is a greater likelihood of a repeat episode of that same ailment. Thus, health management is a centrally important tenet for economic growth and prosperity. And health mismanagement and poor healthcare services hamper not only the aforementioned folks, but also reduce the confidence in the service industry of the nation and indeed its reputation. What are the types of medical malpractices under consideration by the Supreme Court of the United States of America? Number one, misdiagnosis, mistaken or deliberate for increased billable procedures. Incorrect prescriptions. This leads to worsening of conditions to an untreatable stage. Delayed diagnosis. This could be because of incompetence, required tests and procedures were not followed, treatment became too complicated, opportunities were lost. Surgical errors. The wrong procedure was performed, or the correct procedure was performed on the wrong person, or maybe on the wrong body part. Left knee needed a surgery, right knee was opened up. Happens way more than you think. Surgery was unnecessary but done. Avoidable damage to organs, nerves, or tissues occurred, leading to disability or death. Surgical instruments were not sterile. Medical equipment was left inside the patient. Gauze, bandages, scissors, scalpels, left inside the patient and sewn up. Aftercare was inadequate. Failure to treat. Discharging a patient too soon, not providing the correct follow-up care, not providing the standard of care required for their specific condition. Birth injuries. Shoulder dystocia, nerve damage, cephalohematoma, spinal cord injuries, and even cerebral palsy, a lifetime of disability. These terrible injuries to infants are caused by medical errors and can be avoided. Prescription drug error. Misdiagnosis can lead to prescription error, wrong prescription for an ailment, wrong medicine provided. Opioids is a very good example for that. Side effects were not considered thoroughly. Drug interactions and adverse side effects were not considered. Anesthesia error. For a senior citizen or a child in a surgery, anesthesia is probably the most high risk factor for them. Incorrect processes, monitoring device malfunction, inadequate safety protocols during the administration of anesthesia can lead to intense pain, brain injuries, and fatality. Postoperative patient management errors can also happen. Failure to prevent or treat infections. Unsanitary conditions, or your doctor uses equipment that has not been sterilized, and you may develop an infection. Infections are dangerous, and if left untreated, they can cause sepsis, which can be life-threatening. Specifically, pressure ulcers and bed sores. Very, very taxing on a senior citizen who is mobility challenged. What causes these medical errors? Poor training and lack of knowledge. Not all med schools are equal. Human error. Misdiagnosis can happen. Mistakes can happen. A hand can shake at a critical incision. A baby can kick too hard at the time of birth and it can lead to some impact. Too much pressure on the doctor. Too many nights without sleep. Less number of doctors. The number of medical professionals available is limited in many countries. Poor governmental decisions and poor top-down management. In India, it is sad that 58% of all medical practitioners are completely fake. This is a number quoted by World Health Organization. The link is available. Pure greed / avarice. Medical school is expensive, so is board licensing. Doctors want to get a return on investment ASAP. Hospitals are a place of business. Pharma companies, what can I say about them? The opioid epidemic started because of their greed. What happens because of this? In the European Union, we see 570,000 deaths per year which were avoidable, happened because of medical malpractice. This is from 2018. In the United States, it is the third leading cause of death. 250,000 a year in 2016. It has increased. More than car accidents, more than stroke. My own experiences. My father was a decorated Navy officer, a war hero. He had a simple hip fracture. He died because of poor post-operative care at Apex Hospital, Mulund, Mumbai. One of my aunts got a stroke. That's like a blood vessel blockage in the head. The hospital wanted to do a cardiac contrast angiography. That's for the heart. There's no correlation. And doing this procedure might actually put her life at greater risk because she's already very weak. I have literally seen an 8-year-old child get a leg fracture because of poor medication that he was prescribed. He developed liver failure, liver necrosis, and the hospital would not let him get a liver replacement. I've also seen a 14-year-old child, a healthy child, go for a simple ear surgery and ending up brain dead because of the way the anesthesia was handled. Surprisingly, these cases were not classified as murder. There was no criminal investigation. India chose to assign them to consumer protection courts. The judiciary is not really functioning there. It's sad. There are some more cases which are listed at this website that I've linked here. Well, this is one of the saddest cases of medical malpractice. This is little 7-year-old Adhya Singh. She had dengue, a mosquito-induced fever. She was hospitalized for 15 days, but she was dead on the second day that she was brought into the hospital. The hospital just kept her there. They were administering a dead body 44 injections a day. The hospital was evidently using 2,700 gloves by the doctors and nurses on a dead patient. The hospital recommended the complete full body plasma transplant worth over 2 million rupees on a dead person. The cruelty that they did was inhuman. Fortis Hospital, Gurugram, New Delhi, one of the world's superpowers. But being a superlative democracy, when India saw that too many medical negligence cases were being recorded against its doctors, and this was affecting its image globally, it did what a respectable banana state would do. It decriminalized medical negligence. Let's take a look.
First, let's put things into context. These three bills are replacing existing, already extremely popular things like IPC. Everybody quotes the IPC and CRPC and Indian Evidence Act, not that famous probably. But of course, all the talk is around the fact that doctors now don't have to face criminal prosecution if there is a death caused because of their medical negligence.
Well, you're right. That is what the Union Home Minister, Mr. Amit Shah, said in the Parliament. He said that the government was in the process of bringing in an amendment in the Bharatiya Nyaya Sanhita, which is the new Indian Penal Code, where there will be an exemption for medical practitioners for causing death by negligence. Now,
do you think that is correct? Let us see what is happening in the US.
There is new concern this morning that hundreds of hospitals are regularly giving patients powerful CT scans that they do not need. That exposes them to extra radiation and costs taxpayers a lot of extra money. Don Kleffler has.
In this morning's Health Watch, unnecessary medical procedures. Medical experts estimate up to 40% of elective procedures are unnecessary, wasting about $16 billion a year. Some experts say informed consent forms are partly to blame.
There is new concern this morning.
$16 billion, 40% of all medical procedures. I don't think these are mistakes. This is by design. So how would you protect yourself and your loved ones? Of course, number one would be regular checkups and to prevent surprises. I personally believe that all medical emergencies can be predicted in advance and be prepared for. If a person is overweight, diabetic, has a sedentary lifestyle, being at risk for a stroke or a heart disease should not be any surprise. Doing regular checkups and trying to change the lifestyle would lead to better outcomes. If you cook a delicious roast chicken and if you leave it at the window in the full sight of a hungry dog, and then after some time when you come back the chicken is gone, don't be surprised. The chicken did not fly away. Guess what happened to it? Know the diseases that you have a congenital risk for and prepare for them. If your mom had breast cancer and as a woman you don't check yourself regularly, then you are the one to blame. Understand that certain diseases have a very high propensity in this day and age. Heart disease is one of them. Keep a collection of very simple, cheap medicines like nitroglycerin, clopidogrel, aspirin. Make it easily available for yourself, your mom and dad, or any high-risk person, so that if there's an episode, this will save their lives. Understand the fast paradigm for stroke. F, face drooping. A, arms not working. S, speech slurred. T, time to go to the doctor. Fast. I used this in 2018 October to save my dad's life when he had a stroke. I recognized it within 18 minutes of him having the stroke. He got an injection for a tissue plasminogen activator. Within 5 minutes of the injection, he got off the bed, he wanted to go home. Now, subsequent MRI showed zero damage to his brain. You can achieve that too. Research about your healthcare provider. What is his education? Where did he get his degree from? What conferences does he attend? What are his associations with? Which fellowships, etc. And also find out if there is any court cases going on with regards to him. Never be satisfied with one opinion. Seek free and unbiased opinions from multiple sources, with at least one source being an entity which is not money driven. I did that and I saved my own child from an unnecessary high risk procedure. Read and understand your ailment. Speak to support groups if necessary. Understand your options and your risk scenario. Maintain all the records. No matter how much a medical professional may try to pressurize you, recognize the keywords and avoid hasty and emotional decisions. Remember, the doctors and the hospitals, whatever they're doing is for money. They are not your friends or benefactors. What is at stake here? Who are the players? Biomedical companies constitute 80% or more of the Fortune 500 space. It is ever growing and recession proof. With power comes corruption, and with absolute power, absolute corruption. Do not expect this to turn around and end anytime soon. Insurance companies, medical universities, licensing boards, and indeed governments want to restrict access to healthcare. Make it more and more expensive, more profitable for them. Can it be free and amazing? Yes, of course. The best example is Cuba. The Cuban vaccine was better than the Pfizer vaccine. And Pfizer was trying to get access to military bases and embassies from Brazil and Argentina in exchange for its vaccine. Does the world need more Pfizers or more Cuban vaccines? I wish I could end this lecture on a positive note and say that after talking about everything we talked about today, when we open the Pandora's box, at the end of it there is hope. But truthfully, hope in this situation is just a delusion.
Other tree. But man had been created with a hole in his heart, a hole that no possession, power, or knowledge could fill.
That is true. The greed of man is unfathomable, and that leads to our suffering. So while I end this lecture, I want to thank you for your time and attention. And this is the third lecture that I'm doing for your university. In the first lecture, I had introduced my baby boy. I'm a single dad. This is Thor. This is his baby picture and what he is now. He is 8 years old, severely autistic, but with a genius level IQ, very good at math and science, has been featured on national television and newspaper multiple times. We have to make the best of the circumstances, for us, for our families. I want you to use the information that you have learned today to protect yourself and those you love. This is Kaushik Lok, thanking you for your patience and wishing you all the best. Adios.